It's in the zeitgeist at the moment. It's generating a lot of column images, a lot of interest, and hence this meeting was put together. And it's been great to delve more into the science for me personally, because I'm then trying to communicate that and educate the workforce as to how these treatments work. So I really need to keep up with the science myself. And I think where CAR T-cell therapy is really interesting is that it doesn't require the patient's immune system to have recognized or respond to their cancer in order to work. We see a lot of solid tumors at the moment being treated with checkpoint inhibitors. They are exciting, they're really interesting, they're giving some great responses in solid tumors. But where checkpoint inhibitors have their limitation, it is that the patient's immune system has to have already recognized their tumor, has to have already tried to fight their tumor in order for a checkpoint inhibitor to work. A checkpoint inhibitor will work with T cells that are already trying to fight that patient's tumor. If the T cells aren't there, if the T cells haven't been generated, a checkpoint inhibitor can't help you. It is boosting T cells that already exist. Where CAR T-cell therapy is so exciting is that you don't need the patient's immune system to have recognized their cancer. You don't need the patient's immune system to be fighting their cancer in order for a CAR T-cell therapy to help them, because you are taking out some of the patient's T cells and you are educating them, you are genetically modifying them so that they know what cancer looks like and so that they instinctively react against cancer cells. Normal T cells need an intermediary. Normal T cells need dendritic cells to teach them what cancer looks like and to activate them and tell them to proliferate and tell them to kill cancer cells. So normal T cells, in order to fight cancer, they have to recognize the tumor cells and they have to be given instructions and a big boost by the dendritic cells in order to go out into the body and fight cancer cells. CAR T cells, they're different. You are genetically modifying the T cells so that they know what cancer looks like and so that they instinctively fight cancer without the need for dendritic cells. So it's an amazing technology. You're seeing complete remissions, many complete remissions in people for whom all other treatment options have been exhausted. People who've had chemotherapy, people who've had maybe targeted therapies, multiple lines of these treatments, and yet they're resistant to everything. But when you modify their T cells and infuse them back into their bloodstream, they are fighting their cancer and they are delivering complete remissions, which is something that no other technology can deliver. Hence all the excitement, hence this conference just focusing on CAR T-cell therapy.